As Black Maternal Health Week wraps up, a Tampa Bay mother is sharing her story as she calls for action from the community.
The CDC says the latest numbers from 2021 show that more than 1,200 women died of maternal causes in the United States, with the highest deaths among black women. 8 on your side, investigator Brittany Muller joining us now with that story. Brittany, this is part of a national movement.
It is, Keith and Stacy. It's led by the Black Mamas Matter Alliance, and the group is all about preventing pregnancy-related deaths.
I'm a mom. I'm a black mom who's had 2 traumatic birthing experiences of my own.
Dr. Mashara Frost had her first child when she was 21.
I still ended up with my waking up and my baby was in NICU. I didn't know where he was. I had to ask my mom, where's my baby? Where's my baby?
Frost says her son went into distress after a doctor chose to break her water. And her second pregnancy?
And I actually ended up giving birth in the ambulance.
Frost says she was at the hospital having contractions when she was sent home. Within an hour, she called 911.
In the ambulance, I had 1 contraction and she was out and nobody was even on the other side to catch her.
As a passionate advocate,
even though I'm a researcher and I can advocate for myself, nobody listened to me.
Dr. Frost founded the Black Maternal Health Week at USF College of Public Health.
This is an issue that affects everyone.
The CDC says each year in the United States, hundreds of people die during pregnancy or in the year after. Black women are 3 times more likely to die from a pregnancy-related cause than white women.
When you have mothers who are passing away from preventable deaths, nearly 70% of these deaths are deemed preventable. And those are mothers who are lost, who are leaving behind children, who are leaving behind families to be raised by other people, by the foster care system, all of these other entities, so it becomes a community problem.
The CDC also says this disparity is caused by multiple factors, including variation in quality health care, underlying chronic conditions, and structural racism.
We're intentional about engaging these community agencies, bridging that gap between the research, the policy, and the advocacy and the community engagement piece to try to really advance this movement.
Dr. Frost says this initiative is based on community engagement and data-driven action. If you're looking for resources or want to get involved, we'll be posting everything on our website, WFLA.com.
And what options do these women have? I mean, where can they turn?
Right, so we're talking about midwifery or doulas. Those are both becoming more prevalent. There are conversations happening right now about those policies that are needed to expand health insurance to cover this type of care.
All right. Thanks, Brittany.
Thank you, Brittany. If you have something you would like Brittany to investigate, you can call the 8 on your side helpline. The telephone number 1-800-338-0808.